You hear about the dialysis options where people go into center. Are there any home options as well?
Of course, yeah. So in the past, mostly people felt that doing the peritoneal dialysis, where the abdominal cavity is used, was the only home-based dialysis therapy, because peritoneal dialysis is home-based, where people get taught, the equipment's made for them, they get trained, and they do it at home, and it's very nice. But now we also have the option of doing home hemodialysis, where you do use the blood, and the blood is cleaned through using a machine, but you can learn, and it's done with a much simpler machine that we use in the in-center. It's done at home. So absolutely, that's an option that can be done at home, and it's a very good option. It gives independence. It often can help you actually have much better clearance of the toxins, because you can have the option of doing it more frequently. And most people think of hemodialysis as in-center in the hospital, but there's also a lot of community dialysis units closer to home, which are much obviously nicer for the patient to be closer to home, and you develop a nice community with the other people who are in that area. And then even in the in-center, there's now options of doing overnight dialysis. So we call it in-center nocturnal dialysis for people who need more clearance, because it gives you longer dialysis, but also it allows patients to work. It's because they dialyze through the night, they wake up in the morning, and then they have their day for themselves. So I think that over time, we've been able to provide more and more options for treatment and give some autonomy to people.
Are there reasons why you as a nephrologist might recommend one type of dialysis over another to a patient? Is there any barriers for patients?
Very good question. So I think most of us always try to first give the option of giving independence. I think if you can have independence and be able to do it from home, that would always be my first choice. Now, if peritoneal dialysis, sometimes that's not an option, because you may have had a lot of abdominal surgeries and there might be a lot of scarring, and that might have interrupted or scarred the membrane that is then used for the clearance of the toxin. So that may not be a possibility, or the person's home may not be amenable to having everything, or maybe there's some other issues with physical abilities of being able to pick up the bags and stuff. So that might sometimes be an issue. But otherwise, peritoneal dialysis, for example, in people who have heart disease, is a really good option, because it's much more gentler on the body, and it kind of mimics what your own body does a bit more, because it's every day and it's gentle, just like our own kidneys work every day, every minute, but gentle. But for some people, hemodialysis would be a better option, because for those reasons that maybe they cannot do peritoneal dialysis, or maybe they need more monitoring, or they have some other issues with regards to requiring more intensive fluid removal that can be done a bit more intensely with the hemodialysis. So sometimes hemodialysis is the better option, but most of the time, most people can do both. Doing the home-based hemodialysis, it would be wonderful, but sometimes some people, may have issues with being able to do it on their own, because they're by themselves, and to be able to hook themselves up. So sometimes those things can be a bit of a barrier, but most people could possibly do both.